Did you know chronic pain affects more Americans than diabetes, heart disease, and cancer combined? With pain comes treatment, but that can lead to pain medication abuse and misuse. Here to shed light on resources for both the patient and the doctor, Paul Galino from the U.S. Pain Foundation and Dr. Melanie Rosenblatt, Medical Director of Pain Management at North Broward Medical Center. Good morning to both of you. Welcome.
Good morning.
Dr. Rosenblatt, let's start with you. Why is treating chronic pain so complex?
Treating chronic pain is so complex because, frankly, it affects so many people. Chronic pain affects more than 100 million Americans. And like you said, that's more than cancer, diabetes, and heart disease combined. And while prescription pain medication is the mainstay of treatment for chronic pain, it's also prone to abuse.
Now, Paul, can you tell us about your experience with chronic pain and what led you to create the U.S. Pain Foundation?
Sure. 12 years ago, I broke my back lifting a box and twisting, which then severed my sciatic nerve and began my chronic pain journey. On that journey, I realized I need to become more educated, informed, advocated for, and empowered. So I decided to start U.S. Pain Foundation to connect with other people with chronic pain.
And doctor, when people have chronic pain, they obviously take a lot of drugs, or some people do, and that can lead to misuse and abuse. So what can be done?
I think first we need to understand what is misuse and abuse. And in order to understand that, we have to have that conversation. We need some education and some tools. So the survey that was conducted by Teva Pharmaceuticals in collaboration with the U.S. Pain Foundation and the American Academy of Pain Management found that both healthcare providers and people with pain want to take personal responsibility for addressing prescription drug abuse, but also feel uncomfortable having that conversation. So I think first we need to acknowledge that it's the elephant in the room, and it's an uncomfortable conversation to have, and there are many reasons for that. But once we can get past that, we can begin to really do the work and address the issues.
And Paul, obviously you've gone through that. Can you tell us what you did to combat this problem and what you encourage others to do?
Well, I think one of the most important things for people to realize is that they're not alone. And one of the reasons is access to pain meds is a big issue. When we did the survey, we realized people were uncomfortable talking to their doctor about abuse of pain meds. And we also realized healthcare providers were uncomfortable to speak about abuse to their patients. So we realized quickly that we need resources on how to speak and how to start that conversation, which was a big step for me in my pain journey, to realize I need to have that conversation and to be empowered. And painmatters.com brings that kind of resources to both healthcare providers as well as people with pain.
Yeah, there's a wealth of information on that website.
One of the highlights of the study for
Go ahead.
One of the highlights of this study was the critical need for patients and healthcare providers wanting more information. In that survey, we found that more than 75% of healthcare providers and patients really wanted more information. So that's good news. I think addressing the problem, recognizing that we can and do have solutions to address this problem, and a lot of these resources are on painmatters.com.
All right, thank you so much. Again, check out painmatters.com. It's a new resource designed to help both healthcare professionals and people affected by pain. Sean?